Now, African health experts have converged in Johannesburg to discuss the current and future health challenges for the continent. One of the main focal points is universal healthcare coverage as South Africa grapples with the national health insurance. Dr. Bandile Hadebe is a spokesperson for the Africa Health Indaba and joins us now. Very good afternoon to you. Thank you for your time. The NHI is hugely contested in South Africa. I mean, as health experts converge to discuss these issues, amongst others, do you believe it could work and become the solution to the problems in the public healthcare sector?
Good afternoon. Look, it really could work, but I think we need to distinguish between the broader concept of the NHI as a principle versus some of the contentious issues within the actual bill and the policy direction. I think there's an ongoing conversation that South Africa is having that needs to continue, but also continue honestly and embrace divergent thoughts. The current status of how things are run is not sustainable. We are not going to be able to deliver healthcare in South Africa and by extension to the rest of the continent, because South African hospitals and clinics and the broader healthcare systems support patients from other parts of the continent. So there's a huge burden on South Africa to get this healthcare issue properly so that it services its own citizens, but also it services the population of the rest of the continent. Now, the experts that we are bringing into the room on the 17th to the 19th of October are supposed to give us insights and guidelines and frameworks of how some of these countries have pursued these initiatives. There is NHI lookalike systems in other parts of the world that have actually functioned. What can we learn from that as South Africa?
What are some of the really important questions that need to be asked as you make means to deliberate and discuss this issue?
So I think one of the first real issue that we all need to embrace and really peg down as a foregone conclusion is that we all have a mandate to deliver universal health coverage. We all have a mandate to deliver healthcare that doesn't break the bank, that is easily accessible, and that is of high quality. Once we've found each other across the aisle on that particular issue, the question then becomes, how do you do that? And certainly there's a role for the public sector to play, and there's a role for the private sector to play. There's a role for NGOs to play in that broader ecosystem of delivering healthcare. How do we find each other? This tension of wishing away each other and wanting to take over each other's role is probably not going to get us to the right concept. But how do we really find each other? And those are the questions we're going to be asking. But also, how do we optimize limited healthcare resources, both human and otherwise, to provide services for everyone across the board? I mean, you would know, at the current stage, we are not giving access to all available healthcare services to everyone who needs it. There's a huge chunk of resources that is reserved for the private sector, with a very limited portion of the population accessing healthcare within that particular bracket. And there's a huge chunk of our society that has to then fend for themselves through the public sector in a limited healthcare system because the resources are split unequally.
Yeah.
We need to avail healthcare services for all and in a very equal and accessible manner.
Part of the challenges, the doctor-patient ratio is 1 to 4,500. That is terrifying and poses a massive challenge. Why is that? What is the root cause of the imbalance? Is there a shortage of medical graduates? What is the problem?
So there's an absolute basis as a cause of that. We just don't have enough doctors within our system. But also there's a distortion by the dichotomy that is public and private healthcare, where the bulk of the services are available within the private sector and not in the public sector. So part of the reasons around NHI and universal health coverage is to really create equity in terms of access to healthcare and equally distribute those services so that you're able to deliver quality services to our citizens. Now, with the current picture, with the smartest people in the room, you're not going to be able to deliver healthcare. Something really needs to change, and something really radical has to change. We need to reimagine how our healthcare system is structured. But we also just need to train more doctors. Our capacity within our universities currently has not delivered the numbers that, we were looking at. And there's been attempts with other programs to try and bolster the system with additional resources, but we really are just struggling with the numbers. And now when you worsen the situation by this public-private sector dichotomy, you really create this unattainable situation. And not only that, not just on the human resource side, we also have a huge consumable problem. I mean, if you remember the traumas we went through, not just as South Africa, but also as a continent around COVID, when we were looking for gloves, we were looking for masks. I mean, the vaccine program really prioritized other countries, and we were at the tail end of that. We now are awake to the reality that as Africa, we probably need to start aggressively ramping up our capacity to manufacture our own pharmaceuticals, our own medical equipment, our own consumables.
How feasible is that?
It is. It's quite feasible. I mean, you're already looking at a ready-made market of about 1.3 billion people across the continent if we see ourselves as an integrated market. There's capacity for manufacturing in different components of the value chain in healthcare. I mean, certainly in countries like South Africa, like Kenya, like Egypt and Morocco, there is a booming healthcare manufacturing conversation. We are, though, still importing close to 80% of our healthcare medical product. So there's a market that we can accentuate. There's investments that governments have to make. There's investments that the private sector have to make. And there are concepts that, we are bringing about at the Africa Health Indaba. One of them is the health precinct, which really is an integrated special economic zone for healthcare manufacturing. And we're looking at countries like South Africa, like Zanzibar, to set up these health precincts so that this production of healthcare product is localized within the African continent, and we service our citizens directly.
So you're essentially saying Africa should be selling healthcare to the rest of the world?
Certainly, there's nothing stopping us. And I mean, once we woke up to the reality, for instance, around the vaccine program, we started manufacturing enough capacity to supply the rest of the world. So why can't we do that with, diabetic treatment, with treatment for hypertension in any other condition? Why can't we be the hub of the world for this product? Certainly, it's not a mistake that India is the pharmacy of the world currently. There was a strategic decision. They were intentional about it, and they went and drove the necessary intellectual property, the necessary patents, and the necessary APIs. And we now need to get to that conversation and choose very niche, very strategic products that we can drive as Africa to drive our own play in the health economy, to create the necessary jobs, and to drive growth within this particular sector. I mean, we're sitting at about, I think it's 90 billion USD as the total market share that Africa is claiming from the health economy, from a market that is 12 trillion.
Yeah, the opportunities are many. Thank you so much for your time. National Health, Dr. Bandile Hadebe, spokesperson for the Africa Health Indaba, speaking to some of the focal points as African health experts discuss the current and the future health challenges for the continent.